Hey everyone, welcome back to another deep dive.
Yeah.
I know you're all out there battling those red eyes in your clinics.
Uh-huh, yeah.
So let's take a closer look at acute bacterial conjunctivitis and really dissect some of the latest research.
Okay, sounds good.
We're going to be talking about the 2023 Cochrane systematic review on antibiotics versus placebo for this condition. And just to give you a sense of the scale of this review,
Okay.
we're talking 21 randomized controlled trials,
Wow,
over 8,800 participants.
that's impressive.
Yeah, it's like the Avengers of conjunctivitis research, all assembled in one place.
I like it.
So, we all use antibiotic drops for this condition, but have you ever wondered if they really make a difference compared to just letting it run its course?
Yeah, I mean, that's a question I get a lot from patients, actually.
And that's what this review really aimed to answer. So, to get us started, maybe you can explain why a Cochrane review is considered the gold standard in evidence-based medicine.
Yeah, so Cochrane reviews are considered the top tier because they take a really systematic approach. They gather all the relevant studies on a specific topic, and then they analyze the data using rigorous methods to minimize bias. So basically, they're like the detectives of the research world. They sift through all the evidence and give us the most reliable picture possible.
That's a great analogy. So in this case, those detectives had a ton of evidence to sift through 21 trials, thousands of patients. It really is a mega analysis.
Absolutely, and that's what makes this review so powerful. It's not just a small study. It gives us a comprehensive overview of what the research really says.
So let's get to the heart of the matter, the million-dollar question. Did the review find that antibiotic drops actually speed up recovery compared to placebo?
Okay, so get ready for this. The review actually found that patients using antibiotic drops had a 26% higher likelihood of clinical resolution at the end of treatment compared to placebo.
26%. That's a pretty significant difference.
It is, and even more impressive is that when they looked at a later follow-up visit, what they called the test of cure visit, the fluoroquinolone group had a 44% higher chance of recovery.
Wow, that's huge.
Yeah, so it seems like those fluoroquinolones are really packing a punch.
So essentially, we can tell our patients with confidence that antibiotic drops can help them get better faster. And, when you have a waiting room full of itchy, uncomfortable patients, that's a good thing to be able to say.
Yeah, definitely. I mean, nobody wants to walk around with a pink eye for longer than they have to.
But hold on a second. Before we go prescribing antibiotics to everyone who walks in with a red eye,
Right.
it's important to remember that bacterial conjunctivitis can often resolve on its own right.
Oh, absolutely. The review actually found that over 55% of patients in the placebo group still recovered in a similar time frame.
So it's not a slam dunk case for antibiotics every time.
Exactly. It's more nuanced than that.
It is. So antibiotics can help, but they're not always absolutely necessary. Okay, so we've talked about clinical recovery, but what about actually getting rid of those pesky bacteria? Did the review look at microbiological curates?
They did, and once again, antibiotics came out on top. Microbiological cure was 53% higher with antibiotics compared to placebo at the end of treatment.
So not only are patients feeling better faster, they're also clearing the bacteria more effectively.
Exactly.
But I'm sure there's some interesting details and maybe even some surprises in the data.
Oh, there are always some twists and turns. Let's dive into some of those nuances because it's not all black and white.
Okay, I'm all ears.
So one of the interesting things they found was that when they looked at non-fluoroquinolone antibiotics,
Okay.
they only showed improvement in microbiological cure, but not in clinical recovery.
Oh, that's interesting.
Yeah, so it seems like they were knocking out the bacteria, but people weren't necessarily feeling better any faster.
That's a head scratcher.
Yeah, it really makes you think, what's more important for our patients? Is it about eradicating every last bacterium, or is it about providing symptom relief and getting them back to their lives?
It's a great question. And it probably depends on the individual patient, right? Some people might be more concerned about getting rid of the bacteria, while others might prioritize feeling better quickly.
Exactly, and that's why it's so important to have that open dialogue with our patients and really tailor our approach to their individual needs and preferences.
Couldn't agree more. Shared decision-making is key in these situations.
Yeah, absolutely.
Okay, so now let's talk about the elephant in the room, or should I say the pink elephant in the room?
Uh-huh, love it.
Safety. What did the review reveal about the safety of antibiotic drops compared to placebo?
Okay, so the good news is that the review found comparable rates of both ocular and systemic complications between the two groups.
So that's reassuring.
It is. It suggests that antibiotic drops generally have a similar safety profile to placebo drops for acute bacterial conjunctivitis.
Okay, But I'm sure there are some caveats we need to be aware of.
Right. You're right. There are always limitations in research, and the review authors did acknowledge that the certainty of evidence around adverse events was pretty low.
Why is that?
Well, it's mainly due to study limitations, things like small sample sizes or short follow-up periods. So, while the data we have is encouraging, we always need more research to solidify our understanding of the long-term safety profile.
So it sounds like the safety data is reassuring, but we should still maintain a healthy level of caution.
Exactly. It's all about finding that balance between effectively treating our patients and being mindful of potential risks, even if they're rare.
So to sum it up for our listeners who are probably juggling patients right now, what are the key takeaways from this massive Cochrane review?
Okay, so the bottom line is this. Antibiotic drops can shorten the duration of bacterial conjunctivitis and help clear the infection. They seem to have a similar safety profile to placebo, although more research on adverse events is always welcome. However, we need to remember that many cases resolve on their own, and shared decision-making is crucial for optimizing treatment and combating antibiotic resistance.
I love how you frame that. It's
Yeah.
about providing evidence-based care while considering the individual patient and the bigger picture of public health.
Exactly.
Well said. Now, before we move on, I'm curious to get your thoughts on something you mentioned earlier about personalizing treatment for bacterial conjunctivitis.
Yeah.
It seems like there's a growing movement toward the more tailored approach to medicine in general.
There is. And I think in the case of bacterial conjunctivitis, it could be a real game changer. Instead of a one-size-fits-all approach, we could consider factors like symptom severity, patient preferences, and even rapid bacterial testing to determine the most appropriate course of action.
Yeah, the idea of rapid bacterial testing is fascinating. Imagine being able to tell a patient definitively whether their conjunctivitis is bacterial or viral right there in the exam room.
Right.
That would eliminate so much guesswork and potentially reduce unnecessary antibiotic prescription.
Absolutely. It would be a win-win for both patients and public health.
It sounds like we're on the cusp of some really exciting advancements in the management of pink eye. But for now, let's get back to the nitty-gritty of this Cochrane review. Are there any other details our listeners should know about the types of antibiotics studied or the specific findings related to each category?
Yeah, let's get into the weeds a bit.
Let's do it. I think our listeners are ready to get granular with the data.
Okay, let's break it down.
All right.
So the review highlighted that most trials focused on fluoroquinolones.
Okay.
But there were also studies on macrolides like azithromycin and erythromycin, as well as fusidic acid. Even chloramphenicol made a cameo appearance.
Oh, wow. A blast from the past.
Right. It's not a common choice these days, but it was included in some of the older trials.
I remember using chloramphenicol during my residency, but haven't touched it since. Why is that?
Well, chloramphenicol, while effective, carries a small risk of serious side effects like aplastic anemia.
Oh, right.
So unless there are specific reasons, most of us opt for safer alternatives.
Makes sense. Safety first, always. So what were the findings for each category? Did the review dive into the specifics?
It did. For fluoroquinolones, the results were pretty consistent across the board. They showed both clinical and microbiological efficacy. So basically, patients treated with fluoroquinolones were significantly more likely to have clinical resolution and microbiological cure compared to placebo.
That's great news for those of us who rely on fluoroquinolones. It's good to have that evidence-based reassurance. What about the other antibiotic categories? Did they perform as well?
Well, the non-fluoroquinolone antibiotics presented a more complex picture.
How so?
While some, like azithromycin, showed promising results in certain studies, the overall findings were less consistent. The review authors highlighted the need for more research to fully understand the efficacy and optimal use of these alternatives.
So it sounds like we still have a lot to learn about the nuances of different antibiotic choices. It really emphasizes the importance of staying up to date on the research and being open to adjusting our prescribing habits based on the evidence.
Absolutely. Continuous learning is essential in our field, especially with the ever-evolving landscape of antibiotic resistance.
You're right. Antibiotic resistance is a topic we can't ignore. It's a global threat, and we as eye care professionals have a responsibility to be mindful stewards of these valuable medications. What insights did the review offer on this front?
Well, the review emphasized the importance of judicious antibiotic use.
Right.
While antibiotics can be effective for bacterial conjunctivitis, they should be prescribed only when necessary. We need to be careful about overprescribing as it contributes to the development of antibiotic resistance.
It's a tough balance to strike, right? Between treating the infection effectively and preventing the spread of resistant bacteria. How can we as eye doctors find that sweet spot in our daily practice?
Well, I think patient education is key. We need to explain to our patients that not every red eye requires antibiotics.
Ah,
Sometimes supportive care and watchful waiting are the best approach. We can also talk about the risks of antibiotic overuse and emphasize the importance of completing the full course of treatment if antibiotics are prescribed.
those are all great points. It's about empowering patients to be active participants in their own care and making informed decisions about their treatment. But I imagine that takes time and effort, especially when we're trying to see a full schedule of patients. How can we realistically incorporate these conversations into our busy clinic workflow?
It's definitely a challenge, but even a few minutes spent discussing these issues can have a big impact. We can leverage our staff to provide initial patient education.
Okay.
Having clear and concise information pamphlets or visual aids in the waiting area can also be really helpful.
That's a great idea. It's about working smarter, not harder, to make sure our patients understand their condition and the reasons behind our treatment recommendations.
Yeah.
And of course, having open and honest conversations during the exam is crucial.
Absolutely. Building trust and rapport with our patients goes a long way. It allows us to work collaboratively and make decisions that are in their best interest.
Now, going back to the review, were there any other interesting findings or unanswered questions that came up? What are some areas that are ripe for future research in bacterial conjunctivitis?
That's a great question. I think one area that needs further exploration is the role of rapid bacterial testing.
Yeah, we touched on that earlier.
Right. Having a quick and reliable way to differentiate between bacterial and viral conjunctivitis could revolutionize our approach to treatment.
I agree. It would be a game changer in terms of reducing unnecessary antibiotic prescriptions and improving patient outcomes. What about other areas for future research?
Another area that needs further study is the optimal duration of antibiotic treatment. While most guidelines recommend a 5 to 7 day course, there's limited evidence to support this specific duration. Shorter courses might be just as effective in some cases, which could further minimize antibiotic exposure and resistance.
That's fascinating.
Yeah.
A shorter treatment duration would be a win-win for both patients and public health. I'd be interested to see more research on that.
Me too. And of course, we always need more research on the safety and efficacy of newer generation antibiotics for conjunctivitis. As new drugs emerge, we need robust data to guide our prescribing decisions.
It sounds like there's still so much to learn about this seemingly simple condition.
Mm.
It's a good reminder that even common ailments like pink eye can have hidden depths.
Absolutely. It keeps our work interesting.
Well, I think we've covered a lot of ground today.
Yeah.
We've dissected this massive Cochrane review, explored the nuances of different antibiotic options, tackled the challenges of antibiotic resistance, and even peeked into the future of personalized treatment.
It's been a comprehensive deep dive.
It has. So now let's zoom out and summarize the key takeaways for our listeners who are eager to apply this knowledge to their practice.
Sounds good. Let's distill the essence of what we've learned today.
All right, so key takeaways.
Here we go. All right, so key takeaways.
There we go.
Well, first and foremost, I think the big takeaway is that antibiotics can actually shorten the duration of bacterial conjunctivitis,
Okay.
and they can help clear the infection.
Yeah, that seems pretty clear.
Yeah. And fluoroquinolones in particular have shown really consistent efficacy.
That's good to know
Yeah.
because, those are often our go-to choice.
Right. They're the workhorse.
Exactly.
Yeah.
But of course, we always have to be mindful of, the big issue, antibiotic resistance.
Oh, absolutely. That's huge.
Yeah. So we have to prescribe these judiciously. We can't afford to lose these valuable weapons in our fight against, bacterial infections.
Right. It's all about stewardship.
It is. So how can we be more discerning in our prescribing habits?
Well, I think a big part of it is shared decision-making. Talking to our patients, explaining the potential benefits and risks of antibiotics, and really exploring alternative options like supportive care and watchful waiting, especially for those milder cases.
I like that because it empowers the patient too. It's not just us dictating what they should do.
Exactly. It's a partnership.
It is. Now, what about those cases where we're just not sure?
Mm-hmm.
Is it bacterial? Is it viral?
Mm-hmm.
How can we differentiate?
Well, that's where I think rapid bacterial testing could really change the game.
Yeah.
Having a point-of-care test that can quickly tell us if bacteria are present would help us avoid so many unnecessary antibiotic prescriptions.
Absolutely. I mean, that would be a huge win,
It would.
both for the individual patient and for public health in general.
Definitely.
So exciting times ahead, potentially.
Yeah, lots to look forward to.
For sure. So while we wait for those breakthroughs, though,
Mm-hmm.
what can we do now?
Yeah, what can we do today?
Exactly. What are some practical steps that eye doctors can take to, optimize their management of bacterial conjunctivitis?
Well, I think staying up to date on the latest research is always crucial.
Of course.
Guidelines and recommendations are constantly evolving, so you got to stay informed,
Keep learning.
right? Attending conferences, reading journals, participating in online discussions, all those things can really help.
Yeah, knowledge is power, as they say.
It is.
Yeah.
And I think another practical step is to create good educational materials for your patients.
Okay.
Develop some clear and concise pamphlets or even visual aids
Sure.
that explain the different types of conjunctivitis, the role of antibiotics, the importance of proper hygiene to prevent the spread of infection.
I love that. Because, if you equip the patient with knowledge, then they can be a partner in their own care.
Absolutely.
They can make more informed decisions.
Exactly. And at the end of the day, don't underestimate the power of a good conversation. Take the time to listen to your patients, address their concerns, answer their questions thoroughly. That personalized approach can make all the difference.
Couldn't agree more. It's that human touch that really matters.
It does.
So I think we've done a pretty good job summarizing the key takeaways
I think so.
from this massive Cochrane review.
Yeah, it's a lot to digest.
It is. But for our listeners who want to delve even deeper,
Yeah.
we encourage you to check out the full Cochrane review.
Oh, absolutely. It's a treasure trove of information.
It is, and it's a testament to the power of, rigorous research to really guide our clinical practice.
Couldn't agree more.
So until next time, keep those eyes peeled for new knowledge. Stay curious and keep up the great work you're doing out there caring for your patients.
And remember, when it comes to bacterial conjunctivitis, a clear understanding of the evidence is key to providing the best possible care.
Well said.
See you next time.